Hi everyone, Dr. Emi from Pain Free and Fit and Posture Size. Today we've got a great exercise known as the switch for spondylolisthesis pain of the lower back. Hope you enjoy. So if you've taken any of our videos before on spondylolisthesis, you know that one of the main concepts we're working on is to try to prevent that excessive extension in the lower back and that anterior slippage of the spondylolisthesis vertebrae. We have a lot of different exercises to help this, but the switch that we're going to be learning today is designed to increase abdominal control and allow the pelvis to move in rotation and train flexibility of the hips and the torso in such a way that's going to benefit those mechanics that aggravate spondylolisthesis. Before you do this exercise, make sure you put your spine in a neutral spine that's specific for you. That includes your RPI, or reverse posture isometrics, which are the corrections of any of your muscle imbalances that you have, any of the inhibited stabilizing muscles in your lower back. If you're not sure what those are, go to the painfreeandfit.com website, check out our free body analysis there, learn what your asymmetries are, because if you do this exercise or any exercise for spondylolisthesis and you don't have yourself in a unique neutral spine for you with your RPIs on, you're most likely going to be strengthening the dysfunctional mechanics that actually is going to produce more mechanical stress on your spondylolisthesis situation and create more pain. So with that in mind, I've engaged my unique RPI for me. I have my left hip down, my left rib up, I've got my multifidus muscle on the left at L5 engaged, and I'm making sure that my internal oblique on the right side is not over-contracting. That's me. I don't know what you are, but put yourself in your own RPI. So once I have that set, I'm going to start with the top of a push-up position. Now in this position, I'm going to maintain that neutral spine position, and if I have a tendency to have an anterior hip malposition, where I have overactive hip flexor muscles and weak glute muscles, I'm going to make sure I tense the top of my thigh bone back into the hip socket using my buttock muscle to stabilize that, because this exercise uses our abs and our hip flexors, and if I don't have my hip properly stabilized, doing this exercise I'm only going to aggravate or overactivate my hip flexors, which in the long run is part of my whole problem. Tight hip flexors create an anterior pelvis, create more problem for my spondylolisthesis. If you don't know about that hip anterior malposition, check it out inside our websites under the analysis. So once I have that set, from my push-up position, I engage my core. I'm simply going to move one knee across the underside of my body and allow my hips to move with that. I haven't changed my neutral spine. After a second or so, I'm going to move the other way. I'm going to use alternate angles where my knee is not just coming across, but slightly up and down as I do this. And eventually those angles will wind up trying to go underneath my armpit and up to the opposite chest and eventually up to the same chest. And this is training. As I'm in this position, I'm thinking of holding my core so that as the leg moves, as I'm using hip flexor muscles to bend the thigh, those hip flexor muscles are not creating an anterior pelvic tilt. I'm keeping my tailbone under with abdominal tension. I'm not allowing that leg to slide forward in the socket. I'm keeping it back. And I'm sealing a stable spine as my hips and pelvis move. After about 10 to 20 reps, you're going to feel your abs working very intensely with this exercise, and you're training yourself to work your abs in such a way that it protects your lower back. After a set of these, you get up and move around, you're going to feel your hips feel loose, your abs are stimulated, your spondylolisthesis is in a nice position. Adding to that, the only other thing to help with the translation forward of the spondylolisthesis is, remember, once you have a tail tuck under position to engage your abs with this or any spondylol exercise, it helps to have a counter tension, not movement, of the tailbone moving back up. When you do that, it contracts the erector spinae muscles, those muscles along the side of your spine, that as long as you keep that tailbone under tension to counteract, so you have abdominal tension keeping the tail under and counter tension of the tail going up with back muscle tension, it's going to help to delete the extension effect of those erector spinae muscles wanting to arch the back, and instead just use the effect of the lower erector spinae to pull those lower segments at L4 and L5 backwards, or check their motion, so that when you're doing this exercise and my leg is coming forward, the psoas muscle that attaches from the leg to the front of the vertebra is not pulling it forward, but those erector spinae muscles are checking that motion and holding it back, because I have tail up tension even though I've put my body, in most cases of spondylolisthesis, with the tail under to reduce the amount of arch. If you like this video on spondylolisthesis and the switch exercise, Feel free to subscribe to our channel. We got a lot of great videos out there. Questions or comments ready, and I'll do my best to answer them. And remember, if you're looking for a great spondylolisthesis program to help you identify what your muscle imbalances are, what your mechanical issues are, how to do all the right stretches, corrective exercises, coordination patterns, motor patterns, relearn them, and to self-rehab your pain right back into the sports and working out physical activities you enjoy, check out our Fast Track program for spondylolisthesis, available at the painfreeandfit.com website. I hope this exercise switches helps you with your chronic spondylolisthesis low back pain.